In good health, we continue our look at the opioid epidemic, killing nearly 500,000 people in the U.S. since 2000.
Now, a new study tonight is looking at how pain medication is used in the emergency department. So we bring in our own emergency physician, Dr. McGeorge, with the impact on what you're seeing.
Well, Karen and Devin, even though emergency rooms provide a relatively small proportion of the total number of opioids prescribed in America at just under 5%, the emergency department is frankly where many patients are first exposed. And that single exposure can be enough to bring addiction. Emergency physicians want to relieve pain, but a new study shows opioids do not necessarily bring much more pain relief than other medications.
What we're seeing from studies such as this is despite people thinking that opiates are a stronger or a better pain medication, it's not really the case when done in a randomized controlled trial.
The study looked at more than 400 people between the ages of 21 and 64 who came to the emergency department with an injury to their extremities, like a broken arm. One group of patients were given a modest opioid and acetaminophen combination for pain. The other group were not given opiates, but rather a combination of ibuprofen and acetaminophen. Researchers found that after 2 hours, patients in both groups reported about the same reduction in pain. This is important because it suggests patients can be made as comfortable with a non-addictive combination, and the addiction risk to opioids cannot be overlooked anymore.
We now know that even one prescription, even an index prescription, could potentially cause harm and can put someone on the pathway to addiction.
Bottom line, it's important for people to be realistic about their pain level, and having a goal of zero pain with a large opiate prescription is unrealistic and dangerous. Now, one important limitation of this study is that it only addressed the non-addictive alternative, that is acetaminophen plus ibuprofen, basically Tylenol plus Motrin, in extremity injuries. Now, there are other conditions where opiates may frankly still be more effective.
It's interesting that the combo would work, because I think most people would assume that you're taking one or the other, not together.
Right. Well, I think that was an important take-home here, and that's that ibuprofen plus acetaminophen can be an effective pain relief strategy.
Avoid those opioids as much as you can.
Exactly.
Back to opioids for just a second. Today, Michigan Senator Debbie Stabenow has joined 21 other senators in calling on the White House to provide additional funding to combat the opioid epidemic, writing only $57,000. $57,000 available in the Public Health Emergency Fund. The senators say that amount is nowhere near enough to effectively stop the flow of opioids in the U.S.